The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello, and thank you for joining Age-Friendly Caledon Conversations, a series of videos, segment videos, in which we discuss the services and supports of interest to seniors and their families and their connection with Age-Friendly Caledon. I'm your host, Ken Weber, and today our guest is Ravinder Banate, who is the primary care pharmacist with the Dufferin Area Family Health Team. Welcome, Ravinder.
Thank you.
I think we probably should begin with you telling us a primary care pharmacist and what distinguishes that from the pharmacist I know when I go to my local pharmacy.
So primary care pharmacists, so I have worked in retail as well, so community pharmacy, where they basically fill prescriptions, hand you their medications, talk to you about all medication side effects, etc. And then primary care pharmacist, we don't dispense, so we only give medication information. So my job is more dealing with the physicians, getting them to prescribe appropriately, or educating the physicians, the allied health professionals, nurse practitioners, etc., patients, students, about medications, medication safety, and things like that. So helping de-prescribe, like getting patients off medication safely, helping educate how to take them properly. So my job is all about education rather than dispensing drugs.
It would seem so, yes. So we're going to be talking about some very basic things today because I think seniors really want to know all about their medications and what happens. So let me begin with something very basic. Someone goes to his or her doctor and gets a prescription. The prescription then is taken to a retail pharmacy.
Right.
What in a perfect world, when he or she goes to pick up that prescription, what should happen when the patient picks up the prescription?
Actually, I think it should start even before the prescription is even written. So in a perfect world, the physician would diagnose the patient, saying this is what the issue is. The patient would come to me, so I can educate the patient about their disease state, figure out which medication would be the perfect medication for them at that point in time, and check for drug interactions and everything, and then they get the prescription filled, right? So I think that's the way it should really work.
But not everybody can go to see you, right?
Precisely, yes. So in this case, so you go to the pharmacy, so really at the pharmacy level, they should be talking about, are there any drug interactions with any of the medications that I take? Not just prescription, but non-prescription medications as well. People forget even herbals or traditional medications, they can still have drug interactions as well. So looking at that, making sure they're looking at the drug interactions, how to take them properly, because there's some medications that work better in the morning, some medications that work better at night. So is there a perfect time for me to be taking this as well? And we always forget that sometimes the doctors, I think, just assume that if they're prescribing something because you had a side effect to another medication, that we're replacing them. Sometimes patients forget to ask that question. So is this to replace another medication, or is this a new medication that I'm supposed to add to my therapy? So questions like that become really important.
So you should be challenging your doctor with those kinds of questions.
Absolutely.
What is this going to do to me, and is it going to have an effect on me, and so on. Well, so presumably the pharmacist who's delivering the prescription to you will tell you at least some of this information, right?
They should. Like if you're using one pharmacy, which is what I usually recommend, use one pharmacy, get to know your pharmacist, because like when you get to know them, you're more likely to have those relationships built up. They're more likely to figure out that this is not right for you or something's going off with you, right? So having that relationship is really important. But then sometimes if the doctor doesn't write down the information, it becomes hard for the pharmacist to check as well. Sometimes it's easy, like, you know, if let's say you were given a pill for your cholesterol. Let's say you're given Lipitor, and now you're bringing Crestor. The pharmacist will say, "Oh no, stop the Lipitor, start Crestor." Other times it becomes difficult because with, let's say, blood pressure, are we changing the medication, or are we just adding another medication? What's happening with your blood pressure? So they might not actually know unless the doctor actually writes down, discontinue this medication.
I want to come to that again in a minute, but just to finish the thing about calling or visiting the pharmacist and picking up your prescription.
Right.
If the pharmacist is familiar with you, right, and it's a medication that you take, it's a refill,
right,
then the likelihood that he or she is not going to spend a lot of time because they don't, right, need to. But when it's a new one, it's probably expected that the pharmacist will spend a little bit of time with you.
Absolutely. They should be telling you about the side effects. They should be talking to you about any information on the medication, basically.
And that supports your comment that you should try to go to one pharmacy, right, if you can, because, yeah, they'll get to know you.
Precisely. So if you already knew the pharmacist, let's say you were having a side effect to a drug and you said, "Oh, is this cough normal? I've been having this cough and it started around the time that I started a drug." And the pharmacist would have been saying, "Go to the doctor and get this changed," or "I'll talk to the doctor and get this changed for you," right? So then they already know that the drug is being changed. But let's say you went to the doctor and you said, "Oh, I have a cough," and the doctor didn't even mention, "Oh, that could be the drug. Let me change the drug to this," and they just give you another drug. The pharmacist wouldn't know, are we replacing the other drug or are we changing it to this, right?
This leads to a question I was going to ask a little later, but let's deal with it now. Is whose responsibility it is for doing this, for looking after these medications, especially if there is a variety of medication? Is it ultimately the doctor, the pharmacist? And supposedly you have to take some responsibility for your own medication management too, don't you?
I think everybody should be responsible, taking that responsibility themselves, because doctors are responsible, pharmacists are responsible, we all work together as a team, right? But ultimately it's you as a patient who's taking these medications, who this is affecting, and so you need to be the advocate for your own health. That's what I always tell patients, be your own advocate, because nobody else is going to know what's happening with you unless you actually mention this or actually talk about it, deal with it.
Well, then I'm going to jump to yet another question that we often call it Dr. Google, okay? You are giving a new medication by your physician. It's administered to you the prescription is filled by the pharmacist. Mm-hmm. And how safe is it to look up the name of that medication on Dr. Google or on the internet to see if there's indication, side effects, or what the impact of the medication is supposed to be, and so on? Is it safe or not?
Well, it depends on what it is that you're looking at, right? Google is great. It gives you all kinds of information, but they don't put it in perspective for you, right? So like you look up a medication and they'll give you anything and everything that you ever want to know about the drug, including any of the rarest side effects you'll ever see. And we forget that sometimes we're starting, some of these drugs we use for, let's say, for chemo, let's say methotrexate, we use huge doses for chemo. The side effects for that would be different than somebody with rheumatoid arthritis where we're using much lower doses, right? So Google will give you the side effects for chemo drug and you'll be like, oh my goodness, I will never take this drug. But the side effects aren't the same when we're using lower doses. So putting it in perspective becomes very important. So that's why you need somebody with medical background who'll be able to explain this to you rather than just Googling things. I would say people always put the most negative comments on Google, whereas they never give you the positives of anything, right? So, and there's risks and benefits to everything. There's risks and benefits to taking medications and not taking medications as well. So, and we forget the not taking part as well, right? So, so you need to have both. You need to have that balance, and Google does not provide that.
I think you should be available to all of us. You know, you come along in my car, so we'll be able to get information all the time. Then, if we can then go to the basics of taking your medication. There are things, when you get the prescription, it has the timing, how often you should take it. How crucial is that timing? What does 3 times a day mean, in other words?
Right. So in real world, and in perfect world, it should be every 8 hours, right? That's what a perfect world would be. But in real life, we usually just say, depends on the drug, of course. Like if it's an antibiotic, as close to 8 hours as possible. So then there's enough drug all the time to kill that bacteria is important. But a lot of other drugs, it doesn't make as much of a difference. So you can take it with breakfast, lunch, and dinner, depending on what the drug is, right? So. But taking it around the same time each day becomes important. So we know that the more times a patient takes their medication, the less likely they are to continue taking it. Because if you have to take it 3 or 4 times a day for the rest of your life, that becomes onerous. Your life revolves around taking drugs then, right? So that's why we try to change it to a longer acting, so then it's once a day type of thing. So those are the kind of things that I would do, saying, okay, are you able to manage this? And if not, then how do I change this so that way we can manage this properly?
It also says that, and this is something I believe seniors are guilty of this a lot. It says that take it until finished, or take it all. And a lot of seniors are tempted, well, you know, I feel better, so I've got these left, you know, rather than have to go back to the doctor again and go to the pharmacy again, I'll just keep these. That's dangerous, isn't it?
It can be with some medications, yes. So I always recommend asking those questions when you get the prescription filled, or asking the pharmacist, can you put the expiry date on it? Because some medications you can, but an antibiotic I would not recommend it, because the next infection might not even be the same bacteria that's causing it, right? And so it might not even work, and then you're just building resistance to the drugs as well. So
I see. So it would be, so the point is take the whole thing. And if you have any doubts, go back and speak to the pharmacist, who's probably more accessible than your doctor would be.
Right.
And so they become, in that sense, very primary care too, don't they?
Well, now they can prescribe for minor ailments as well, right? So
yes, that's a new development, and I think a very valuable one too, isn't it? Yes. So then, do you have, we're going to take a break in a few minutes, but I think we can get this in. A schedule for remembering. Seniors forget. Actually, everybody forgets, but we're probably a little worse than others for not remembering. So do you have any advice? Is there a method you suggest for remembering to take your medication, at least on reasonable time frame?
Actually, I think we all forget, because life gets busy, and the way our brain works, we think that we've taken it, and then we really haven't. So I usually recommend having things like Dossets available.
Show that to the camera, would you please?
So these are just, you can get them all different kinds. So it's like little boxes where you can put your medications in for morning, noon, and night, and it has the days of the week on here as well. So then you can actually visually see. So today is, let's say, Monday morning, and if the Monday morning pills are still sitting there, then I haven't taken them, right? Or if Monday evening pills are still sitting here, then I forgot to take this. So visually it becomes easier.
And it's called Dosset?
It's called Dossets, yeah, or plastic. I usually just say plastic containers for your medications, because you can get them all kinds where you can take some with you. There's like a day one, single one, all kinds. And then for some people, they have a hard time filling this themselves, because it's hard to open bottles, especially when we get older or we have Parkinson's or other diseases or osteoarthritis. Then the pharmacies can put it in a blister pack for you. So the blister packs sort of look like this. Again, they fill it up with morning, noon, night, etc., and with the pills all in there, and then all you do is just take them out and take them. So
we're getting away from the floor director. I'm going to get you to show that again after our break, because I think it's very important. Thank you. We'll have a break now and come back. Thank you.
Hi, I'm I'm Angel Morgan, host of Raising Energy on Rogers TV. Join us each week as we are back in the studio doing live psychic readings. I work with guides, guardians, angels, archangels. I'm a free-for-all. I even bring through animals and messages from loved ones to bring you closure. Check out rogerstv.com/raising energy for our listings and airtimes and for your free tickets.
Thank you. Welcome back. We're talking to Ravinder Banate about medication management. And before the break, you were starting something very interesting and very worthwhile. I think if you don't mind holding up that dosette package again, please. This contains a method of isolating your medication so that you know what time and what day.
Right.
And then you also were starting to show us the blister pack.
Right. So the blister pack is dosettes you can get in all different kinds and shapes and sizes, and just talk to the pharmacist and they can show you. And this is something you would fill yourself. The blister pack is something the pharmacy would fill for you. So it comes in little bubble packs, as you can see, and it would have like morning, noon, evening, and bedtime, and it goes by day of the week as well. And they will fill up every week for you. So then visually it's there, everything is there that you would be taking, and then the pharmacy is the one that's responsible for filling, making sure you have enough refills, making sure that there's no, that they're in the proper spot, so like where medication should be, and if something's discontinued, they would take it out. If there's something added, they would add it in, so pharmacy would take care of all that for you.
This is very important to know. You also brought something else with you, new to me, and I think would be new to a lot of other seniors, and it's called Vial for Life?
Vial of Life.
Vial of Life.
So different paramedics they're the ones who are leading this program, and you can get this from, most pharmacies carry it in Orangeville area anyway, or paramedics office also carries this as well. So you can get this as container, and it has a list of, you can put your list of all the medications, your names, your contact informations, any POA, like power attorneys, or any emergency contacts on here. All your medical conditions can go on that little sheet that's inside. And inside is also a little magnet that it comes with. It says Vial of Life on it. So you fill it up with everything that you take, all your medical conditions and everything, and then you put this in the freezer, and you put the Vial of Life magnet on top of the freezer. So if anything happens to you and you can't talk, let's say you're unconscious, they come in, they're trained to go and check the fridge. And so when they see this, they go into the freezer, take out the Vial of Life, and all your information is here. So then they take that with them to the hospital. So then the doctors know exactly what you take, what conditions you have, and they can make sure, and any allergies and all that stuff is on here as well. So then they can make sure that they provide proper information to you. Or
that's terrific for seniors because it's not on an iPhone. Right. It's not something electronic. That's very, very worthwhile. And it's called Vial of Life.
Right.
And you can pick it up in Orangeville area at one of the pharmacies?
One of the pharmacies, or the paramedic, which is just down the street here as well.
Right.
Yeah.
Well, that makes medication management more forward and simple.
And even for electronic, a lot of people have electronic records, but then nobody else has their access codes, so then nobody can get into it. Or if the phone dies, then again, the information is lost, right?
And they don't know where they've put it, because if that marker is on the fridge door, then that's really very interesting. I'd like to go to something a little more controversial now. It's inevitably controversial for seniors, and it's called we all know it as over-medication.
Yes.
And I think it's a partner with mixing medications. Right. So pick one of those and tell me what you have to tell us about that.
Well, I think it's all a combination, like both of them work together, right? So, and over-medication, it can happen by accident as well. Like we call it the medication cascade, right? Let's say you had a cough, like we talked about before. You had a cough with medication, then they give you another medication to help deal with that cough, and then you had side effects to that, then they give you another medications to deal with that side effects. So all of a sudden you're on a whole host of medications, when if we just stopped the first one, you wouldn't have had to take all the rest of them, right? And it happens slowly, and all of a sudden you realize you're on huge amounts. And so at some point, so now the government pays a pharmacist, it's called for a meds check. So it's called a meds check program. So you make an appointment with your own pharmacist and go through all your medications. And I recommend everybody do that if they're on 3 or more medications. So the government pays for this program because they realize how important this is. And the pharmacist will go through your medications and make sure you take all your herbals and vitamins and everything with you as well, because there are drug interactions with those as well. And they will go through drug interactions. They will see, are you on any duplicate medications, or are you taking them properly? They'll do all that for you, and it actually ends up saving not just taxpayer dollars, because seniors' medications are being paid by taxpayers, but it also helps you as well. And then you can go through, like, I'm having this side effect, or is this a side effect of the drug? These are the symptoms I'm experiencing. Could this be the drug doing it, or is it that just me, you know? Because sometimes we don't realize we're tired or we're fatigued during the day. Is it the drug, or is it just I'm getting old and that's why I'm feeling this way, right? So.
Okay, I'm just going to get you to repeat something here. This is very important. I didn't know about this, and I'm sure a lot of other seniors didn't know about this. This is available at any pharmacy in Ontario, and it's the pharmacist is paid by the government to provide this information. So if you have this feeling or this certainty that there's something wrong, and it could well be a factor of the medication you're taking, you make an appointment with the pharmacist to discuss this. Right. And in theory, the pharmacist would be more quickly accessible, let's say, than your family doctor, who has to wait and is busy, and you'd have to make another appointment. Yeah,
we all have our specialties, right? The doctors are great at diagnosing a problem. Pharmacists are great at looking at the drugs themselves and seeing if they're the cause of the problem. So medication errors occur. A lot of people are in the hospital because of medication errors to start off with, right? So they occur at different points. So at not just prescribing, but at different points. So government realizes that, so that's why they're willing to pay a pharmacist to do this. So you just need to make an appointment. But anytime you're in the hospital before, let's say you're going for a surgery, getting a medication review done before surgery is important, because then you have proper list beforehand, and they can tell you this needs to be stopped or this needs to be changed before surgery. After a hospital visit, they'll pay for that as well. If you're diabetic, they'll pay for that, because we know diabetes causes a whole host of other problems. So, and if you're on 3 or more medications, then the government pays for it as well. So,
isn't this review normally part of admission for surgery?
It should be, but it doesn't necessarily happen all the time. You know, it depends on how busy everybody is as well. And I find that there's always that one patient that sort of falls through the cracks. So if you take responsibility for your own health, right? So you know you're going for surgery, you just say, can I make an appointment to talk to you before my surgery? And most pharmacists would love to sit down with you and say, okay, yes, stop your aspirin or stop this, and so many days beforehand. So.
And then it would be also your responsibility then to take that information with you to the hospital, to the surgery, to present that to them.
Ideally, every patient should have that list of allergies and medications and medical conditions that they take with them every single time they visit their healthcare provider. Doesn't matter whether it's a pharmacist or a doctor or hospital or walk-in clinic, they should have that information with them all the time. Because the number of times people say, oh, I had a reaction to this, but then they can't remember what the reaction was. So then we don't know which medication we can give them, because there are a lot of medications that are in the same family. So if you had anaphylactic reaction where you couldn't breathe, we can't give you any drug that's in that family. Whereas if you just had a, let's say, upset stomach, then we can try another medication that won't cause the same effect, right? So knowing what the reaction is important as well.
It would make it doubly important in places like the emergency ward, because if you had to go to emergency, they tend to be pretty chaotic, and they're very, very busy. So if you can supply information in advance,
Right.
that would make a big difference. I don't suppose you could carry the vial of life. You could keep something similar in your pocket in case it was needed?
You can just photocopy it and keep a copy in your pocket as well. A lot of people do that too. Or if it's something urgent, let's say you're on a blood thinner or whatever, then I always recommend that they wear a medical or type of a bracelet, like where they have something in writing. Because if you're on a blood thinner, you're more likely to bleed in an emergency, right? So they need to take care of you first. So having that on your person where it's easy to access, it's so important as well. So papers takes time. It takes time to go through your wallet and all that as well. But if it's an urgent type of thing, then have a bracelet. Like if it's an allergy that's anaphylactic, or you're going to have conditions which will cause problems in emerge, then have it on a bracelet or a necklace.
And that I noticed that that's become relatively common. People to have the warning bracelets, and I know that if you go to Emerge, that happened to me once where I got a red tag on because I'm allergic to a particular antibiotic. Right. So this is still backing yourself up though by having this information easily available.
Right, because the more easy you can make it, the better it is overall for not just you, but everybody who's taking care of you as well.
Very good. There's one other issue that comes up here when we talk about the professionals that you deal with. Should you decide for one reason or another to change your pharmacist, and you've been going to one particular pharmacist for some time, and you're not, well, for some reason you want to change. You've moved, you're not satisfied or whatever. What steps do you have to go through? If you're taking 3 or 4 medications, do you have to inform the doctor that you're changing them because you don't have a refill on it?
There's a few different ways to do it. One is you can just ask the pharmacy to just transfer the file to the other pharmacy. So
it's that simple?
It's that simple. You just call the pharmacy and just tell them like you want to change, and can you fax over? Because you just have to give permission, right? Or you can get a new prescription from your doctor and take it to the pharmacy. But I always talk to the pharmacist or the pharmacy personnel and make sure that your file is there, that they know that you're transferring over, right? And that they just don't get a piece of paper and they're going, okay, maybe they just send it to the wrong pharmacy, right? Things like that do happen. So have a file present, make sure that you let them know about all your, like who you are and everything as well.
This has been very valuable. I mean, there are obviously challenges with medication, but they can be managed, and you've given us some very, very good advice. We've been talking to Ravinder Banate, who is the primary care pharmacist for the Dufferin Family Care Health Team, and you've been extremely informative. We really enjoyed this. Thank you very much, Ravinder, and thank you for joining us on Age-Friendly Caledon Conversations. These are segments of videos designed to help residents age well and in place. On your screen now, you should be seeing information for making further contact. You can either phone Caledon Age-Friendly Caledon at 311, or you can email adult55@caledon.ca, or you can visit the website online www.caledon.ca/adult55, where you can sign up for the monthly newsletter on e-newsletter, giving you more information about aging well in place in Caledon. This video will appear on Rogers and later on YouTube. Thank you again for watching, and thank you, Ravinder.
Thank you.
I'll be eventually.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Hi, I'm Jennifer. And I'm Allison. Coming up on the next parenting show, we're talking about taming the rude attitude. If you've ever said, I would never talk to my parents that way, you need to tune into this show. That's only on Rogers TV.
It'd be a tragedy if we were losing one person to drug overdose every day. 5, 7, or 12 people, that would